People of all ages struggle with stress, depression, and trauma. Today, we have an expert who is going to help us understand why people suffer with these and other mental health issues and answer your questions next on Dr. Q&A. Hi, everyone, and welcome to Dr. Q&A. I'm Olga Villaverde, and joining us today from Mount Sinai in New York is Dr. Jonathan DePierro. He is, by the way, the Assistant Professor of Psychiatry and the Clinical and Research Director at the Center for Stress, Resilience, and Personal Growth. Thank you so much for joining us on Dr. Q&A, sir.
Thank you for inviting me to speak to you.
Oh, anytime. It's our pleasure. And by the way, just a reminder to our viewers, if you do have a question for our expert, there are several ways you can get in touch with us. You could phone us or email us. Send us your question to questions@allhealthtv.com. Give us a call, 855-796-4475. And you can visit our website, allhealthtv.com, and send in your question that way as well. We would love to hear from you. Okay, doctor, let's first start about just, the pandemic. Let's be honest, millions of people have been grieving the loss of someone, unfortunately, throughout this pandemic. And they've been mourning through Zoom, FaceTime, in a way that we never thought would ever happen. And let's be honest, it's not the same as being together. So let's go to that first question that we have from someone who has suffered through all this. And it's from Denise. And this is what she writes. I recently lost a close friend who had been very sick. I cry, feel guilty, cry again, and get angry that the pandemic kept us apart. Is this part of the grieving process? And if so, when does it end? I'm so sorry for your loss, Denise. And she is just one of so many others, doctor, that have endured this terrible pain.
So thank you for your question, Denise. And again, I'm also sorry to hear your loss, suffered by so many during the pandemic. And you asked a question about grief. And maybe the heart of the question is, what's normal grief? And when should you see a healthcare professional about the grief that you're experiencing? And we know that people grieve over many different trajectories. People grieve and they're really in that depth of grief for a few weeks. And others, they're really stuck in that period of grief and distress and mourning for many, many months, even years. And I would say, not knowing you very well, that one of the things to watch out for is when the grief that you're experiencing interferes with your life, when you have trouble getting out of bed, when you can't sleep or you have no energy, you're feeling guilty and it's just overwhelming guilt that you can't do anything to shake and it's just sticky and going throughout your day. And you might even have thoughts of suicide or thoughts of wanting to be reunited in death with the person that you lost. And that's pretty common. And at the same time, those are warning signs that it's time to speak to a healthcare professional. When that grief for weeks and weeks starts to interfere with your life and you can't go to work, you can't go to school, and you can't do the things that you did before because it's overwhelming.
And doctor, I was reading here that there are 5 to 7 stages of grief. Obviously, every individual is different. Do we need to go through those stages to, I guess, overcome and move on?
Right. So there's been many, many years of research on stages of grief, speaking to people who've grieved. But I would say that, again, grief is so individual. There are general things that we know about grief, but I wouldn't say that it's the case that you need to go through all of the Elizabeth Kubler-Ross stages of grief, the researcher who coined some of these stages, in order to grieve successfully or to grieve in a way that it doesn't impact your life any longer, that you've come to terms with the loss and made sense of it.
Do you have any, and I know we could go on forever and we have so many questions, but do you have tips to help someone with the grieving process? Sometimes I think walking and exploring nature is helpful. Listening to music. What are your thoughts?
Right, those are good distraction techniques. One of the things that we know now about the pandemic is that some of the rituals that we have around losses have been disrupted. there aren't wakes or funerals or other kinds of spiritual services anymore because it's just not safe. There's been public health restrictions. And one of the pieces of advice that I give to my patients, and I would encourage your listeners to think about, are the ways in which you personally want to remember the people that you've lost. Is it lighting a candle? Is it writing a letter to them personally? Is it having your own, individual memorial service or saying a prayer to them in your mind? How do you want to mourn them, separate from what's possible or what's not possible right now with a group? Making your own rituals and to connect the person that you've lost, to acknowledge their life and to make sense of the loss to the extent that you can.
I do want to talk about something in terms of more than just grief, but the result of the COVID-19 pandemic. They're saying that there could be a mental health pandemic in the near future. Let's watch this short video and we'll talk about it right after, Doctor.
The number of COVID cases in the U.S. continues to trend down, and more states are rolling back virus-related restrictions. But experts warn about a coming mental health pandemic. They say establishing boundaries about what is acceptable in your life can help.
So many people come to therapy feeling powerless. And, a part of my job is to empower them to create the sort of life that they want. And that starts by having some boundaries and communicating those things. I've seen when people start to use their voices a bit more, that some of that anxiety and depression, it certainly decreases.
Getting some physical activity and taking time for meditation can also help to soothe the spirit.
Just some thoughts, Doctor. Is there already a mental health crisis? We've obviously been through more stress than we ever imagined would ever occur to us in the past year and a half.
So certainly there is some evidence that we're seeing increased rates of depression and anxiety. There was a recent survey done by the American Psychological Association of adults in the United States, and it found that the vast majority, I think over 60%, the results showed, experienced an increase in their anxiety levels during the pandemic when they were asked. And for some folks, that brings them into care, it brings them to see a mental health professional. And I know even anecdotally that many folks are going to see mental health professionals right now, and there might even be wait lists to see mental health professionals in some areas because of the increased utilization of people seeking out care that they certainly need. But certainly more research needs to be done, more work needs to be done on examining these trends in people's mental health.
And Doctor, I just got a question in that I want to read to you, and there is no name, but the viewer does ask this. There's a lot of grief that involves loved ones who are very, very sick, but they haven't passed. Mm-hmm. Their lives will never be the same. How do family members cope with that? Your thoughts?
Right. We know, excuse me, I'm sorry for interrupting. We know that from the research, this is called anticipatory grief. So you're anticipating a loss that is going to happen. It could happen in minutes, it could happen in days, or even months, someone who's ill and maybe in an ICU. And what I would encourage is to find ways of connecting to that person while they're alive. Think about ways that your time with them is meaningful. Even though you can't do the same things with them before, you can make memories. Maybe you could share laughs if the person is awake and oriented, but you can sit with them, even have a conversation, even if they can't talk back, to create those memories and meaningful moments in that time that might help you with that anticipatory grief.
And Doctor, refresh my memory, because I've heard along the way when number one, I studied, and number two, you hear about the anger stage, the denial. What are those stages that one has to go through, which are normal stages, if you will, to once again be able to mourn and then again move on?
Right. I would say from my own work, certainly there's anger and denial. And, speaking Kubler-Ross stages aside, one of the things that I would definitely say is important is understanding the loss in the broader context of your life, that these losses happened and these people were meaningful to you. and that they will live on in your memory and you can connect with them always. And that this loss should not define you moving forward as a person. It should be one thing that happened to you, but it should not define you as a human being. But sort of coming to terms with the loss, meaning making of the loss.
Absolutely. And I personally don't like to get personal when it comes to my personal issues, but I'm even dealing with a personal crisis where something is expected to happen, and it's extremely difficult, and the anger is beyond measure, doctor, if I could just be completely honest with you. But I'll move on from that anger eventually, somehow. And just a reminder, I want to let our viewers know, please, if you have a question for our expert, all you have to do is give us a call, send in your question. The phone number, you see it right there, 855-796-4475. And you can email us, questions@allhealthtv.com. We certainly would love to hear from you. Doctor, I have a viewer question here from Charnel. I'm going to read it, but let's see what she has to say and we'll talk about it. I am concerned for a friend who has been acting out of character. How can I approach the subject of mental health without triggering a negative reaction? I love this question because there are so many people in our lives where we want to approach them, doctor, and we don't know if we should or how to do so. So what would you tell Charnel, doctor?
A tricky question. And I think one of the things that one should keep in mind is that they know that person best. They might know how to approach them, what language to use. You might want to script out different things that you might say in your mind. The best piece of advice that I can give is to notice out loud, or notice objectively, and as objective language as possible, what you're seeing. So for example, Charnel, you might say to your friend something like, I noticed you've been a little different lately. Or I noticed that you've been a bit more tired, or maybe a little bit more irritable. And just say that out loud. Notice that they've changed. Notice something's different, and see what they say. Just objectively noting without judgment what you're seeing. You would not say, are you depressed? Are you angry about something? Just notice out loud what the change you're seeing in their behavior without making an assumption about what may be causing it, because you might be wrong.
Absolutely. And I've heard, doctor, and correct me if I'm wrong, that one of the things never to say is, what's wrong with you? Your life is great. You snap out of this. One never knows, right? You need to listen, just listen.
That's absolutely right. And we know that depression, for example, strikes people regardless of how much money they have in the bank or how good of a job they have on paper. Depression is something that you might not see. It can look like an invisible wound, where objectively it looks like everyone has everything going for them. Wonderful family, great job, big income, lots of vacations, but they're depressed. They can't experience the joy that others might feel in those situations, and others who don't have it as much. So we shouldn't make assumptions about what might be causing or not causing someone to feel depressed or anxious, because everyone is different.
And I'm glad.
So it's better.
I'm sorry for interrupting you, doctor. And I'm so glad you brought up depression, because again, sometimes we don't see the signs, and some people say teen depression is just sadness, and that's not the case. It can affect how a teenager can feel, how he can act, how he can behave, which leads me to a story from the Mayo Clinic. They put together 5 signs that your teen could be battling depression. I think this is important to watch. Let's take a watch.
It's no secret that teenagers can be moody, but research shows that ongoing moodiness often is far more serious.
Depression is much more common than most people realize. This is something that affects teenagers of all walks of life, of all backgrounds, and actually of ages from as young as 12, sometimes even younger, and up to the young adult years.
Dr. Jana Gawartz-O'Brien, a Mayo Clinic pediatrician, says new guidelines suggest screening all teens for depression starting at age 12.
About half of kids are not identified with depression when they have it in the primary care setting, so we need to make sure that we're catching more of those. We can do better.
Dr. Gawartz-O'Brien says parents should also be looking for these 5 signs their teen is depressed: excessive irritability or generally depressed mood, trouble sleeping or excessive sleeping, sudden severe weight gain or weight loss, a sudden drop in grades in school, and sudden loss of interest in activities they used to enjoy.
If somebody reaches out to you and says, I'm worried I'm depressed, or I'm thinking about harming myself, that is something to be taken very seriously, and that's where your primary care provider can really help.
Your thoughts on this, doctor?
I would completely agree with those 5 warning signs. Those are characteristic symptoms of depression. One of the things that I would also note is that teenagers and many adults even can't really name how they feel. They might not have the words to describe how they're feeling at the moment. They might just say bad, or they might be dismissive and abruptly say, I'm fine, but that's not the case. So I think we need to also be mindful that people might not understand what's going on with them, might not understand how they're feeling, and that a simple I'm fine should not be taken at face value, especially if there are other warning signs like those 5 other signs that are happening at the same time.
And doctor, any thoughts for parents who have had children home, obviously for maybe a year, virtual? Many have not even seen their friends. Things are improving, and we know that, but a lot of time has passed and an effect has been made. Any ideas for parents who have said, wow, this has taken a toll on my child? How do I get over this hump and get them back to normal?
Right, that very well might be a gradual step, especially depending on where you are in the world or in the country and what the precautions and what the rates of COVID are. What I would say is to find something that you can do, find one small step that you can take. For example, if the child has not seen their friends in a while, it might be that you plan a gathering where people are appropriately distanced and it's in your front lawn if you have one, or backyard, or in a public park. Or they begin to hang out on, a video call and do maybe they do a board game or play something fun together that brings up that joy again. And those things can be planned, and those are baby steps to sort of re-socializing people to being in play groups or being on the playground or being back at school and having some semblance of normalcy. It might mean that you have to take small steps to get there, and you can't just jump into the deep end of the pool.
And doctor, I just want to remind our viewers, if you have a question to our expert, just give us a call or send us the question via email. It's really easy to do. Our phone number, 855-796-4475. And you can email your question to questions@allhealthtv.com. You can even videotape yourself on the cell phone and download it right there on our website to the right, allhealthtv.com. We'd love to hear from you, as always. Doctor, I have a question here. How much or how little should parents share their fears and anxiety with their children? I like this question, and we just got it in from a viewer. You know how we kind of always put up a front and we say everything is fine, the sun is always going to come out, everything is rosy. How much do we really tell them? It could be a parent losing a job or finances getting a little bit more difficult. There's just so many things. What do we do?
So I would say one thing that to keep in mind is it depends on the developmental stage of the child, how old the child is. But in general, children, like most adults, kind of know when something's up. You might try to hide it as an adult that you're very fearful or concerned or anxious. But I think it would be important to find some way to convey those to your child, because it models that saying that out loud is okay, that the child, when they grow up, can learn that it's okay to be afraid of something. And it can be okay to say it out loud without the heavens collapsing and the sky falling. And that the child knows that you're in that problem solving together. Like, you're going to solve this problem and work on it as a family. And that they might have fears too, that you then telling them about your fears and language that works for you helps them to feel more comfortable expressing the things that they're afraid of, which might be some of the same things.
Absolutely. Doctor, I was reading here the CDC says some people might react to stress immediately. Others may not experience stress until later, which is something that you started talking about at the beginning of the show. Would you say this is causing an increase in PTSD, post-traumatic stress disorder, especially amongst healthcare workers, those that were on the front line, they've seen a lot.
You're absolutely right. Our healthcare workers on the front lines have seen a tremendous amount. They've seen tremendous human suffering, loss of life, death on the scale that they've not encountered before at any part of their training. They've had to make very difficult medical decisions. They've had to be at patients' bedsides while their loved ones were saying goodbye on a video call, if they could at all. And that takes a tremendous toll. And they, at the same time, were afraid of contracting COVID and bringing it home to their families and becoming sick themselves. So all of those things could potentially cause PTSD. And by what we mean by PTSD is a stress reaction that's intense and continues long after the threatening situation is over. So that could be nightmares or trying to avoid thinking about something traumatic, being irritable or on edge. That stress response switch is stuck in the on position and is not diminishing when the stressful situation is over. And for our healthcare workers, the stressful situation itself hasn't even been over at all. It's been continuous. And we are seeing increased rates of PTSD in our healthcare workers. And even now, with the COVID numbers coming down, it's sort of the analogy that I like to make is going through a firefight, coming back to your base, and then realizing you've been hit. It only after the battle dies down can you take stock and realize how much you've been damaged or injured, because you're running on adrenaline. The adrenaline runs out, and then you see, your injuries, the results of that combat.
And speaking of combat, I think of our frontline workers as I do with our amazing veterans that come back from combat. And thank goodness we have them, and we thank them every day for our freedom. But it continues on for years to come. And I think of these healthcare workers, and I wonder, once we all get back to normal, what about them?
Right. And that's something we're certainly very concerned about. And on the forefront of thinking about at Mount Sinai, we have the Center for Stress Resilience and Personal Growth, where we provide mental health treatment to our healthcare workers at no cost to them. So all of our Mount Sinai healthcare workers are eligible to get care with us. We provide lots of outreach and engagement and workshops around learning skills to boost resilience and improve mental health to our healthcare workers. So it's something we've been thinking about for over a year, and certainly well before that with our experience with prior disasters like 9/11.
And God bless you for doing that, because they truly deserve that and so much more. Doctor, we have an email question from Karen. I love this question, and I'll tell you why after I read it, but it's on telehealth. By necessity, by necessity, because of the pandemic, people are using telehealth. Are there studies that demonstrate the success of telemental health compared to in-person counseling sessions? I love this question because I'm such a people person, and I think telehealth has been fantastic. Please don't get me wrong. But I also like the contact with my doctor, right? I like to say, doctor, right? Here I am. And I like him to hug me or tell me everything's going to be fine. So it's a new world. So help Karen out with that question and tell me your thoughts.
Karen, this is a question near and dear to my heart. I was been involved in telehealth efforts for many years, even before the pandemic. And I should say, just looking at the research, looking at what the scientists have to say, one of the sources that we can look to is the Veterans Administration. The Veterans Hospitals have been doing telehealth for many, many years, I think even 20 years or more, doing some form of telehealth. And because of those numbers, they can actually do the work and say, do the outcomes of patients in terms of their mental health, of the patients getting telehealth, differ from those getting in-person care? And by and large, the answer is no, that there's no difference in the impact or outcomes of folks engaging in in-person treatment versus telehealth. Now, at the individual level, what we know is that the provider and the relationship between you and the provider matters. So if you go to a provider and you don't have that trusting relationship, whether it's telehealth or in person, that treatment's probably going to be less effective. So the advice to you is telehealth or in person, find someone that you connect with, find someone that works for you and that you can engage with and that has your goals in mind in every session.
What a great answer. Thank you so much for that question, Karen. Doctor, we've only got a couple minutes left, and I do want to ask you two more questions here. A lot of people have heard the word resilience. I love that word. That's one of my favorites, along with perseverance. But I think resilience is really big today. Why?
So resilience is big because people are stressed, and resilience has to do with what happens as people go through stress, everyday stress or the life-threatening stress of the pandemic. There's 1,000,001 definitions of resilience. So I'm going to give one definition that I happen to like. And resilience to me is the ability to bounce back, grow, and adapt to life's challenges. I have a lot of colleagues who do this work thinking about how we define and measure resilience and what we can do to enhance resilience. And I should say that there are lots of things that you can do to build up your resilience, like a muscle that you're building up. But I also want to say at the same time that you can be resilient in some areas and struggle in others, and that emotional distress and resilience are not mutually exclusive. They both can happen. You can be distressed about what you're going through and even have PTSD or depressive symptoms and still be resilient by waking up every morning and going to work and being with your kids and making your bed and reaching out to people. You can build those strengths up even as you're suffering through something horrible.
Doctor, thank you so much for your time. It's truly been an honor to have you. You are so soothing, and it's been a pleasure.
Thank you so much for the invitation.
I hope we see you again soon. You take care.
Thank you.
And that's all the time we have for today's show. I'm Olga Villaverdi. We hope to see you next time right here on Dr. Q&A. You take care.
The Health Channel wants you to have all the answers you need to be in control of your health.
Infection and the virus keeps coming back.
That's why, in addition to Dr. Q&A,
if treated appropriately, the patient should...
you can always chat with one of our health advisors through our free service, Ask Hannah. Just go to allhealthtv.com or download the Health Channel app and get the answers you need.
No question should ever be left unanswered. Remember, if you don't know where to start, ask Hannah.